This message is for you. Many seniors are unknowingly doing something daily that quietly worsens insulin resistance, fatigue, and inflammation without realizing it. Pause. This is not about expensive treatments, complicated routines, or quick miracles that promise results but leave you disappointed. Across the United States, physicians referencing research from major universities published before this year have been studying blood sugar changes in older adults with serious concern. Before we begin, comment your age and country, stay with me until the end, and subscribe now so we can build a supportive community focused on long-term health. What most people do not realize is that how seniors drink water matters just as much as how much they drink. This is where things get interesting. Many adults over 60 unknowingly wait until their mouth feels dry or their energy drops before reaching for water, and by that point the body has already been under quiet stress for hours. Thirst is not an early warning system, it is a late-stage alarm. In older adults, that alarm becomes even less reliable because the brain's thirst center weakens with age, meaning dehydration can exist long before any conscious signal appears. This is why so many seniors say, "I didn't even feel thirsty," yet their blood sugar readings tell a different story. When a large amount of water is consumed all at once, the body does not interpret it as nourishment. It interprets it as a sudden fluid load. The kidneys respond quickly by increasing urine output, flushing much of that water right back out. Along with it go critical minerals like sodium, potassium, and magnesium, all of which play direct roles in insulin signaling and glucose transport. What most people do not realize is that these minerals act like keys that allow glucose to move from the bloodstream into the cells. Without them, sugar stays circulating longer, forcing the pancreas to release more insulin. Physicians working with older adults have observed a consistent pattern. Seniors who drink water in large bursts tend to experience sharper blood sugar spikes after meals and deeper energy crashes later in the day. This is not because water is harmful, but because the delivery method overwhelms the system. Aging kidneys process fluids differently, and rapid intake increases the risk of temporary electrolyte imbalance. That imbalance subtly interferes with hormone communication, especially insulin and cortisol, both of which are already more fragile after 60. Here is what happens inside your body in simple terms. Your cells are like small rooms that need steady moisture to function properly. When water arrives too fast, it stays mostly in the hallway, the bloodstream, instead of entering the rooms where it is needed. Cells remain underhydrated, stress hormones rise, inflammation increases, and blood sugar control becomes more difficult. Over time, this pattern contributes to insulin resistance, not because of sugar intake alone, but because the cellular environment is not prepared to handle glucose efficiently. Doctors were surprised to find that seniors who shifted from catch-up drinking to slow, consistent sipping throughout the day showed measurable improvements in fasting glucose and overall stability. The change was not dramatic or immediate, but it was reliable. One glass consumed slowly every 60 to 90 minutes allowed minerals to remain balanced, supported proper absorption, and reduced unnecessary strain on the kidneys. This steady approach also supported protein metabolism, which is essential for maintaining muscle mass and blood sugar control in older adults. This is not a personal failure, and it is not simply aging. The body is responding exactly as it was designed to respond under stress. When hydration becomes steady rather than reactive, the internal environment becomes calmer, hormones communicate more clearly, and blood sugar regulation begins to feel less like a daily battle and more like a system that finally has support. Many adults over 60 proudly say they drink plenty of water, yet their blood sugar remains stubbornly unstable, energy feels inconsistent, and muscle weakness slowly progresses. What often goes unnoticed is not the amount of water, but what that water lacks. Modern filtered, distilled, or purified water may look clean and safe, but it is biologically incomplete for an aging body that depends on minerals to function properly. This gap quietly affects blood sugar in ways most seniors have never been told. Water on its own does not hydrate cells efficiently. It needs minerals to act as carriers. Sodium, potassium, magnesium, and trace elements help water move from the bloodstream into the cells where it is actually useful. Without these minerals, water passes through the body quickly, increasing urination without improving true cellular hydration. Many older adults experience this as frequent bathroom trips paired with persistent dryness, fatigue, or lightheadedness, even though they are drinking enough fluid. Doctors treating seniors with prediabetes and type 2 diabetes noticed a pattern that raised concern. Patients who relied heavily on low-mineral bottled water or aggressive filtration systems often showed higher fasting glucose levels and greater insulin resistance. Blood tests frequently revealed low magnesium, a mineral directly involved in insulin sensitivity and glucose metabolism. Magnesium helps insulin bind to its receptor, allowing sugar to enter cells. When levels are low, insulin becomes less effective, forcing the body to produce more of it, increasing strain on the pancreas. Inside the body, the problem becomes more complex with age. As we get older, absorption efficiency declines. The digestive system becomes less effective at extracting minerals from food, especially when protein intake is low or stomach acid is reduced. This means water becomes an even more important delivery system for minerals. When water lacks them, the deficit compounds daily. Hormones that regulate blood sugar, including insulin and cortisol, begin to misfire because they rely on proper mineral balance to send clear signals. Physicians were surprised to find that something as simple as restoring minerals to water improved not only hydration markers, but also inflammation levels. Chronic low-grade inflammation is common in seniors and plays a significant role in insulin resistance. Adequate mineral intake helps regulate fluid balance inside cells, reduces stress signaling, and supports smoother glucose uptake. Seniors often report feeling calmer, steadier, and more mentally clear when mineral balance improves, long before lab values fully change. This is not about turning water into a supplement routine or adding complexity. The body recognizes minerals as familiar supportive elements it has depended on for decades. A small pinch of natural salt in one glass of water, or choosing a mineral-rich water with meals, can significantly improve absorption without overwhelming the system. The goal is not excess, but consistency. Minerals help water stay where it belongs, inside the cells, supporting protein synthesis, reducing muscle breakdown, and stabilizing blood sugar responses. What many seniors are experiencing is not failure or decline. It is the predictable result of a modern environment that removed essential elements the aging body still requires. When minerals return to the equation, water becomes supportive rather than neutral, and the body responds with greater efficiency, resilience, and metabolic balance. Many adults over 60 have been advised for years to drink water with meals, believing it supports digestion and blood sugar control. Yet physicians began noticing an unexpected pattern. Seniors who consumed large amounts of water during meals often reported bloating, fatigue after eating, and unpredictable blood sugar readings. This was not random, and it was not a coincidence. The timing of water intake changes how the digestive system performs, especially in an aging body. As we age, stomach acid production naturally declines. This acid is not just for comfort, it is essential for breaking down protein, activating digestive enzymes, and preparing nutrients for absorption. When large volumes of water are consumed during meals, stomach acid becomes diluted at the very moment it is needed most. What most people do not realize is that even mild dilution can significantly slow digestion in older adults. Food sits longer in the stomach, proteins are not fully broken down, and glucose absorption becomes erratic rather than steady. Doctors working with seniors were surprised to find that many patients struggling with post-meal blood sugar spikes were not overeating carbohydrates. Instead, they were unintentionally weakening digestion. Poor protein breakdown leads to reduced muscle maintenance, which directly affects blood sugar control because muscle tissue is one of the primary sites where glucose is stored and used. When protein digestion is compromised, muscle loss accelerates, insulin sensitivity declines, and blood sugar regulation becomes more difficult over time. Inside the body, the process unfolds quietly. Diluted stomach acid sends weaker signals to the pancreas and intestines. Digestive enzymes are released less efficiently, slowing nutrient processing. This delay causes glucose to enter the bloodstream unevenly, sometimes all at once, triggering higher insulin release. Hormones struggle to coordinate properly, and the body responds with fatigue or sleepiness after meals. Seniors often describe this as feeling heavy or drained, assuming it is just aging when it is actually a timing issue. Research from major universities initially underestimated this effect, assuming water intake during meals was harmless. Later observations showed that in older adults, excessive water at meals can worsen reflux, impair mineral absorption, and increase inflammation markers. Magnesium, zinc, and iron absorption suffer when stomach acid is diluted, and these minerals are essential for insulin signaling, oxygen delivery, and energy production. Over time, this creates a subtle but persistent metabolic disadvantage. Physicians observed improvement when seniors adjusted timing rather than volume. Drinking water 30 minutes before meals prepared the digestive tract without interfering with acid production. Waiting at least 1 hour after eating allowed digestion to complete before introducing additional fluid. This simple shift supported stronger protein digestion, more stable blood sugar curves, and improved nutrient absorption. Seniors often reported feeling lighter after meals, with steadier energy and fewer cravings later in the day. Here is what happens when timing is corrected. The stomach maintains adequate acidity, enzymes work efficiently, proteins are fully broken down, and glucose enters the bloodstream at a controlled pace. Insulin response becomes smoother, inflammation decreases, and hormones regain rhythm. This is not about restriction or discipline. It is about allowing the body to do what it was designed to do without unnecessary interference. What many older adults are experiencing is not digestive failure or inevitable decline. It is a system reacting to mixed signals. When water supports digestion rather than disrupting it, the body responds with improved balance, clarity, and metabolic stability that feels noticeably different within weeks. Many adults over 60 live with daily discomfort they rarely question. Swelling in the ankles by evening, stiffness in the joints upon waking, brain fog that comes and goes, or a constant low-level fatigue that never fully lifts. These signals are often dismissed as normal aging, yet physicians have learned they frequently point to chronic low-grade inflammation driven in part by improper hydration. What you are experiencing is real, and it deserves attention. Inflammation is the body's protective response, but when it becomes persistent, it quietly interferes with blood sugar control. In older adults, dehydration does not always look like thirst. Instead, it appears as thicker blood, slower circulation, and stressed cells. When cells are underhydrated, they trigger inflammatory pathways as a survival response. This inflammation disrupts insulin signaling, making it harder for glucose to move from the bloodstream into the cells, even when insulin is present. Doctors treating seniors with diabetes and prediabetes noticed something striking. Patients who reported poor energy, joint discomfort, or mental cloudiness often showed elevated inflammatory markers alongside unstable glucose levels. When hydration patterns were corrected, inflammation began to decrease before blood sugar numbers improved. This surprised many clinicians because inflammation was not initially seen as a hydration issue, yet the connection became difficult to ignore. Inside the body, the process is both subtle and powerful. Dehydration thickens the blood, forcing the heart to work harder and slowing oxygen delivery to tissues. This increases stress hormone release, particularly cortisol. Cortisol raises blood sugar to ensure energy availability during perceived stress. When this happens repeatedly, insulin resistance worsens. At the same time, dehydrated cells become less efficient at absorbing nutrients, including glucose and amino acids needed for protein repair. Muscle tissue weakens, further reducing the body's ability to manage blood sugar effectively. Older adults are especially vulnerable because the natural anti-inflammatory systems of the body become less responsive with age. Hydration plays a crucial role in flushing inflammatory byproducts from tissues and supporting lymphatic circulation. When water intake is inconsistent or poorly absorbed, these waste products accumulate. Seniors often feel achy, sluggish, or emotionally flat, unaware that hydration-related inflammation is influencing not just their joints, but their metabolism and hormone balance as well. Physicians observed meaningful changes when seniors focused on steady hydration rather than reacting to symptoms. Consistent water intake throughout the day helped lower markers of inflammation, improve circulation, and reduced cortisol spikes. Patients reported fewer afternoon energy crashes and more stable moods. Blood sugar readings became less erratic, not because carbohydrates changed, but because the inflammatory environment inside the body had calmed. This shift does not require extreme measures. It requires awareness. Pale yellow urine, reduced swelling, clearer thinking, and smoother digestion are signs the body is receiving what it needs. Hydration supports absorption of minerals that regulate inflammation, including magnesium and potassium, and helps proteins repair tissues more effectively. When inflammation decreases, insulin can communicate clearly again, and glucose handling improves naturally. This is not weakness, and it is not a personal failure. Aging bodies are simply more sensitive to internal stress. When hydration supports circulation and reduces inflammation, the body responds with greater stability, resilience, and a sense of ease that many seniors thought they had permanently lost. Many adults over 60 do everything they are told to do. They watch sugar intake, walk regularly, take prescribed medications, and drink what they believe is enough water, yet blood sugar control still feels fragile. This is where physicians began to notice a deeper issue that connected all the previous patterns together. The body was receiving water, but not in a way that allowed it to coordinate hormones, absorption, and glucose handling at the cellular level. Timing, not effort, was the missing factor. Cells rely on rhythm. Just as hormones follow daily cycles, hydration must arrive in a predictable, steady pattern for the body to function efficiently. When water intake is inconsistent, cells move between mild dehydration and sudden overload. This instability forces the body into a constant state of adjustment. Stress hormones rise, insulin signaling becomes less precise, and inflammation quietly increases. Doctors were surprised to find that even small disruptions in hydration timing could amplify blood sugar fluctuations in older adults. Inside the body, hydration timing acts like a control center. When water enters the system gradually, minerals remain balanced, blood volume stays stable, and cells can absorb glucose smoothly. When long gaps occur between drinks, blood becomes more concentrated, circulation slows, and cells signal distress. The body responds by releasing cortisol to maintain energy, which raises blood sugar. When water finally arrives in large amounts, the system rushes to correct itself, often flushing out minerals needed for insulin sensitivity. This cycle repeats throughout the day, keeping blood sugar regulation under constant strain. Physicians observed that seniors who adopted consistent hydration timing showed improvements even without changing diet. Fasting glucose became more stable, post-meal spikes softened, and energy levels felt more predictable. This was not because water lowered blood sugar directly, but because it allowed insulin, glucose, and minerals to interact in a calmer environment. Protein utilization improved, supporting muscle tissue that acts as a reservoir for glucose. Hormones regained a sense of coordination that had been missing for years. This is where everything connects. Proper hydration timing supports mineral absorption, reduces inflammation, improves protein metabolism, and stabilizes hormone communication. Without it, even the best nutrition plans struggle. The body cannot prioritize long-term regulation when it is constantly correcting short-term imbalances. Seniors often feel this as a vague sense that nothing quite works the way it should, despite doing everything right. The simplicity of this shift is what makes it so often overlooked. Small, regular amounts of water throughout the day signal safety to the body. Cells relax, stress hormones decrease. Insulin can do its job without resistance. Blood sugar becomes less reactive because the internal environment is no longer unpredictable. Doctors noted that older adults often describe this change as feeling steadier, not dramatically different, but quietly more balanced. This is not about strict schedules or rigid rules. It is about giving the body a pattern it can trust. Aging systems thrive on consistency. When hydration timing becomes reliable, it supports every other effort, from diet to movement to medication. Many seniors who struggled for years found that once this piece was addressed, progress finally felt possible, not because the body changed overnight, but because it was finally working with support instead of constant disruption. For many adults over 60, the idea of changing daily habits feels overwhelming, especially after years of managing blood sugar, medications, appointments, and conflicting advice. What physicians emphasized was that improvement did not come from doing more, but from doing a few things in a more supportive order. The body responds best when signals are predictable and gentle. A simple daily hydration rhythm became one of the most sustainable changes older adults could actually maintain. In the morning, the body wakes slightly dehydrated after hours without fluid. Blood is thicker, circulation is slower, and cortisol is naturally higher. Drinking 1 glass of mineral-supported water shortly after waking sends a powerful signal of safety to the nervous system. It supports circulation, improves absorption of morning medications or nutrients, and reduces the stress response that can elevate fasting blood sugar. Doctors noticed that seniors who started their day this way often saw more stable morning glucose readings within several weeks. At breakfast, restraint becomes supportive rather than restrictive. Waiting before drinking allows stomach acid to do its job. Protein digestion improves, which matters more after 60 than most people realize. Adequate protein supports muscle tissue, and muscle acts as one of the largest glucose storage sites in the body. When digestion is efficient, blood sugar rises more slowly and insulin response becomes smoother. Older adults often report feeling more satisfied after meals and less fatigued mid-morning. As the day continues, steady hydration every 60 to 90 minutes maintains blood volume and mineral balance. This consistency prevents the cycle of dehydration stress followed by fluid overload. Physicians observed that seniors who followed this rhythm experienced fewer energy crashes and less afternoon brain fog. Cortisol levels stabilized, inflammation markers gradually declined, and hormone signaling improved. The body stopped reacting and started regulating. In the evening, reducing fluid intake before sleep protected rest quality. Sleep is a critical but underestimated factor in blood sugar control. Poor sleep raises insulin resistance and inflammation. Seniors who stopped drinking large amounts of water late at night reported fewer awakenings and deeper rest. Better sleep reinforced the benefits of daytime hydration, creating a reinforcing cycle rather than competing signals. Doctors were careful to set realistic expectations. The body does not reverse years of imbalance in days. During weeks 4 to 6, many older adults noticed subtle changes, steadier energy, fewer sugar cravings, and improved digestion. Around 3 months, blood sugar readings often became more predictable with fewer spikes and drops. By 6 months, visible improvements appeared in lab work, stamina, and overall resilience. Progress depended on consistency, not perfection. Physicians stressed that this approach mirrors how chronic conditions are managed successfully. Just as blood pressure control requires ongoing attention, hydration timing supports blood sugar only while it is maintained. Stopping once improvements appear often leads to regression, not because the method failed, but because the support was removed. Long-term health in later years depends on sustainable systems, not temporary interventions. This approach was never presented as a replacement for medical care, but as a foundation that allowed other treatments to work more effectively. When hydration supports absorption, hormones, protein metabolism, and inflammation control, the body becomes more responsive rather than resistant. Seniors who embrace this perspective often described feeling more in control,